Hello, everyone. I'm Martell Teasley, Professor and Dean of the University of Utah College of Social Work. It is my pleasure to welcome you all to the first event of the College of Social Work's 2020-2021 Grand Challenges for Social Work Speaker Series. Today's event is titled Homelessness in Utah, Partnering to Develop Strategy. For those unfamiliar with the ideal of the Grand Challenges, they are a call to action for social work researchers and practitioners to one, harness social work science and knowledge base, two, to collaborate with individuals, community-based organizations, and professionals from all fields and disciplines, and finally, to work together to tackle some of our toughest social welfare problems. The College of Social Work is committed to this speaker series as part of our effort to address the grand challenges for social work, which are truly grand challenges for our communities and all of us. We are pleased to launch the second year of this series, focusing on an issue of great importance to many communities, homelessness. Today's presentation brings together skilled campus and community voices to share their expertise and experiences. I am delighted to introduce the moderator for this event, Sean McMillan. Sean began his work working within the field of substance abuse treatment services in 1987 at the university's Neuropsychiatric Institute. While at NUI, he moved from serving as a counselor on the graveyard shift to the position of primary counselor of the recovery unit and program manager for experiential therapy. He joined the First Step House in 2003, becoming executive director in 2005, well known through Salt Lake County. Along the way, Sean earned his master's in public administration from the U. Sean is also chair of the college's Community Advisory Board. Before I yield the screen to Sean and our experts, I want to take a moment to thank all of those who supported the Students Emergency Fund. Contributions through the college's webinars events have raised nearly $3,000, and our students have received another over $20,000 in support through the university and the CARES Act. My thanks to you on their behalf. Thanks again to all of you for being here today. Sean, take it away.
Thank you, Dean Teasley. And thanks to all of you for joining us. As Dean Teasley said, I'm Sean McMillan, and I'm pleased to be here with an outstanding group of professionals who will bring a deep knowledge and sincere concern to the issue before us, homelessness. We will talk about research, address structural systems that cause homelessness, consider the added barriers comorbid health conditions create for this population, and strategize solutions. It will be a full 80 minutes. We will begin this event with a presentation by two talented University of Utah faculty members from the College of Social and Behavioral Sciences. Dr. Lina Svedin and Dr. Jesus Valero have worked together with a cadre of students and community partners to study homelessness and consider the local and national plans for combating it. We look forward to hearing their report and recommendations for the first part of this presentation. In the second half, we will welcome our panelists, Dr. Sarah Canman from the College of Social Work and Architecture and Planning, Michelle Flynn, the Executive Director at the Road Home, and Miles Southwick, police officer with Salt Lake PD and recent graduate of the U's Executive MPA program. And then we will take your questions. We look forward to having you join the discussion using the Q&A feature to ask our presenters and panelists questions, and the chat feature to share your own expertise. To get us started, I will share a little about each of our presenters. Dr. Svedin is focused on pressing public policy issues, particularly social policy, risk management, and ethics. She is passionate about bridging the gaps between research and practice, as well as teaching and research. Dr. Svedin serves as an interdisciplinary research leader for community engaged research in Utah and across the country. She is currently on loan to the federal government, working out of the Air Force's School of Advanced Air and Space Studies for 2019 and 2020. Dr. Jesus Valero is an assistant professor in the Department of Political Science at the University of Utah. Dr. Valero's research explores government nonprofit relationships, effective leadership in nonprofit organizations, and the use and impact of technology in public service. His work has been published in academic and practitioner outlets and is a recipient of the Emerging Scholar Award from the Association for Research on Nonprofit Organizations and Voluntary Action, and the Founders Fellowship Award from the American Society of Public Administration. His research has been funded by the Robert Wood Johnson Foundation, the Korea Foundation, IBM Center for Business and Government, and the Utah Foundation. Jesus earned his PhD in public administration with a specialization in nonprofit management from the University of North Texas, Master of Public Administration from the University of Texas Pan American, and BA from University of Texas San Antonio. Lina and Jesus, the stage is yours.
Thank you so much, Sean. And really it's a pleasure to be here today and to present a little bit about the work that Lina and I completed almost a year ago. So I'll start sharing my screen now and I'll begin the presentation. And we thought we would divide this conversation in two parts to talk about the strategic plan that Lina and I developed almost a year ago in partnership with the Department of Workforce Services and others in the community as well. So I'll talk first about the process and the research side of it, and then Lina will jump in on the second half to talk more about the substantive policy issues surrounding homelessness and the recommendations that came out of the strategic plan that she and I worked on last year. So to begin, we thought we would cover a little bit of the background of what sort of was the impetus for developing a strategic plan in the state of Utah. So in the spring of 2019, the Utah legislature amended existing statute and required the State Homeless Coordinating Committee to create a strategic plan. As some of you may be aware, the State Homeless Coordinating Committee is a structure that was developed in order to centralize and coordinate efforts around homeless policy across the state, and obviously trying to achieve higher levels of collaboration and coordination through this centralized statewide committee. So this committee was tasked in 2019, spring of 2019, to develop a strategic plan that would cover at least 4 things. Number one, that outlined the specific goals and measurable benchmarks to achieve progress in reducing the incidence of homelessness. Number two, the statute required that this committee work on developing a plan that identified gaps in service delivery to the variety of homeless populations. So understanding that there are a variety of services already out there in the community, there was this need to understand what gaps existed across the homeless service system. Number three, they wanted this plan to provide recommendations to the government and the legislature on strategies, policies, procedures, and programs to address the multidimensional needs of individuals and families that are experiencing homelessness across the state. And lastly, they really encouraged and expected that the strategic plan identified a set of best practices and that recommended improvements in coordinating service delivery to the variety of homeless populations through the use of electronic databases and through data sharing among service providers. So again, this was the impetus for developing a strategic plan in the state of Utah, something that had not existed before. Okay, let's see, here we go. So a little bit about the initial steps that Lina and I took, or how all of this sort of began once the legislature sort of put that mandate out of developing a strategic plan. So the Department of Workforce Services, the Division of Housing and Community Development, is currently serving as the administrative arm of the State Homeless Coordinating Committee. And so they were tasked with seeking out a contract in order to develop a planning team that would be responsible for leading the efforts across the state in developing a statewide strategic plan. And so Lina and I have been working over years in the area of social and homeless policy, and have developed a passion for community engaged research, working with students, working with community partners, and with an interest in policy issues that are pressing, complex, and that are important for addressing today. And so over time, we have enjoyed developing a level of trust with local community partners and former students of our various programs in our programs of public affairs. And so this experience and these community partnerships were enough for one of our alums, who happens to also be in this call today, Sean McMillan, was a person who reached out to us and said, hey, there's this effort undergoing, across the state to develop the strategic plan, and connected us to the Division of Workforce Services in order for us to have a conversation around this need to develop a strategic plan and exactly what was expected. So we met with the Department of Workforce Services team and discussed the project parameters. So this was around the time of end of April 2019. So we quickly had that meeting and discussed sort of the need, the challenges around developing the strategic plan, the timeline that was expected. So there had to be sort of a quick turnaround in developing this strategic plan. This whole thing in process had to be completed by the end of the summer, with the expectation that the plan would be presented to the State Homeless Coordinating Committee and adopted in the early fall. So we developed a proposed plan for conducting the strategic plan that was pretty detailed and offered ways of how we could go about this process in such a short time with limited resources, limited time. And that got proposed to the Department of Workforce Services. And then we proposed this as well to the State Homeless Coordinating Committee. And it was them that ultimately approved our effort and said it was okay for us to begin the work. So we thought we would tell you a little bit about our actual research approach and how we went about conducting this work statewide. So we realized that, again, with about 60 days of time to develop a statewide strategy on homelessness, we were limited in time and in resources, and we had to jump into doing the work right away. So we thought deeply about a three-prong approach for developing this work. So first, we felt it would be imperative to jump into the literature first, to understand policy context, factors, trends, challenges, and opportunities around homelessness programs, homeless policy, not just in the state of Utah, but across the United States. So for us here, some of the key tasks, for example, would include reviewing research publication reports and policies, existing federal statutes, current state statutes here in Utah, as well as statutes in other states across the country. Another key task for us as well was collecting extensive Department of Housing and Urban Development data and Utah-specific data. We were fortunate to get access to Utah-specific data through the Department of Workforce Services and the Homeless Management Information System of the state in order to develop a strong understanding of the data trends of the homeless sort of incidents across the state and across communities over a period of time. And ultimately, our goal here was to analyze data using quantitative methods and qualitative methods as well to understand what were, some of the key factors that we're sort of developing out of the data that we were looking at. A second step began and specifically explored best practices. As the statute sort of expected for us to look at best practices of possible benchmarks, possible measures of performance, of achieving impact in the community, and of programs that were existing not only just in the state of Utah, but in other communities. So some key tasks for us here included identifying example communities or states that were close in demographics, community needs, and community challenges. So for example, what we ended up doing here was identifying other Western states based on census data for a number of reasons. One, we were in the same sort of regional area. Two, also some of these states have similar population groups. And so we decided to just adopt that as sort of our sampling frame and to identify communities in those areas. Another task here was studying existing efforts, programs, and policies that were effective in Utah as well as other communities, and to conduct interviews with key stakeholders across the state and in other communities as well. And then lastly, we felt that in order to develop a plan that was comprehensive and that was indeed for all of Utah, we thought that it would be imperative for us to conduct community engaged conversations across Salt Lake and other communities across the state of Utah. And so we engaged in conducting focus groups with key stakeholders from all the communities across Utah. And so here we asked communities to identify, key leaders of homelessness programs, individuals with lived experiences, service providers from the government, nonprofit sectors, and others to come and join in a community conversation about what is happening in those areas, and what are some challenges, what are some needs, what are some of the service gaps, and what do they think that is needed in order for us to move the needle on issues of homelessness within their very specific community. So some key tasks here were mapping networks, resources, and needs. And really the main point of these focus groups was to seek feedback on best practices and propose benchmarks through these particular focus groups. So our process for working together before turning it over to Lina to talk more specifically about what we found and what we learned from this process of working together. This all involved both just Lina and I, and the recruitment of 10 very talented public affairs graduate students, one of whom is with us today, Miles Southworth, who's joining us today and will give a perspective from the law enforcement sort of side of this issue. And what we sought to do was engage a number of graduate students for a number of reasons. Number one, these are future leaders of government nonprofit organizations in our community. And so we found it imperative and sort of a key value of Lina and I to engage these students and to train future generations of potentially homeless service provider leaders and others in the community. And so through a process of extensive training and reflection, we engaged these students and they assisted us in conducting focus groups across the state, traveling countless of hours to every corner of Utah and conducting those focus groups, and then leading those focus groups together and having long hours of conversations on our drive back, and learning from each other sort of what we heard, what we learned, what we sort of experienced through those focus groups. And all of that information was imperative for us to use and to understand sort of multiple perspectives of this particular issue. And then of course, a ton of support from administrative staff, not just from the Department of Workforce Services, the Division of Housing and Community Development, but also folks at the College of Social and Behavioral Science and within our department as well, who provided us support. Then our community across Utah was imperative and sort of key to us being successful in conducting this work across the state of Utah in such a limited time. So we were able to achieve 14 focus groups across 23 counties in the state of Utah with over 170 participants from the various sectors, advocates, individuals with lived experience, and others who joined us in a conversation around homelessness and what was occurring within their specific community. And then lastly, and more specifically, the engagement of the 3 continuums of care in the state of Utah. So these are groups that are collaborative bodies formed under federal policy. And so there's a total of 3 of these across the state that work together to coordinate services. For example, there's one in the Salt Lake Valley area, Salt Lake County. That's now the Salt Lake Valley Coalition to End Homelessness. That is also now the continuum of care for the county. It's, for example, one of those. So we engaged all 3 key continuums of care for the state of Utah, 12 local homeless coordinating committees, as well as federal partners, including HUD and the United States Interagency Council on Homelessness. So this was a very elaborate, extensive process of working together. And we felt this was the way to move forward, that there was no way that we could develop a statewide plan on homelessness for Utah if we didn't engage all of these variety of key stakeholder groups in the process of developing this strategic plan. So with that, I will turn it over to my colleague, Lina Svedin, who will talk more specifically about some of the policy issues and some of the recommendations that came out of the strategic plan.
Thank you, Jesus, and thank you, Dean Teasley, and thank you, Sean, for that introduction and the opportunity to talk about the work that we've done here in the state of Utah on this really complex issue of homelessness. And so I think one of the things that's important to remember as we're talking about homelessness as a grand challenge in social work and in social policy is that the causes of homelessness are multidimensional, and that individuals that experience homelessness more often than not need more than just housing support, right? This is a complex problem that can and should be tackled in a coordinated way involving stakeholders from all sectors, because this the problem of homelessness reaches into and affects many different aspects of society, and we have many resources in different areas of society that we can draw on. The federal strategic plan, the most recent one, is called Home Together, and it acknowledges that the solutions to homelessness are going to have to take all of us working together, doing our parts and strengthening our communities. And that is exactly the approach and the mandate that the Department of Workforce Services and Division on Housing and Community Development, who are community partners in this work, that was the approach that they took, and that's what we carried into the process of helping communities think strategically. So having said all that, one of the things I wanted to talk about was the choice that Jesus and I made very early on. Like we said, we didn't have a lot of time, so we had to make some important choices early on and very quickly. And one of the things that we both agreed on would be fruitful is to take a collaborative approach to developing the plan. And what we did in this collaborative approach was we took key elements of strategic change processes, so what we know about how to create strategic change in organizations and communities, and we coupled that with an interdisciplinary, community-engaged research process, right? What Jesus has just described. We added to that the fundamentals of trust building, because that's very important if you're going to get people in groups to collaborate. And that together, those three things together, helped us produce this statewide strategic plan on a complex social problem, homelessness. Now, the reason why we chose a collaborative approach, there are many reasons, but some of the more important ones was homelessness as a policy issue and a social problem has been surrounded by some political tension in Utah. There's been a lot of spirited debates about the causes of homelessness, the policies that should be implemented. A lot of different programs have been piloted successfully on a smaller scale. And there was generally a lot of discussion at the time we got this this mandate to develop the strategic plan or help develop it. There was a lot of political conversations about where Utah should be going. So there was a little bit of a political sensitivity to this. Collaborating would allow us to bring in many stakeholders and at least air the different perspectives and sometimes conflicting ideas people had about what ought to be done and why it ought to be done. It's also the case that a lot of the funding for homeless services is federal, and HUD's continuum of care programs provide a lot of funding for homeless services here in Utah, but it requires local communities to pool their resources and to work collaboratively to sort of leverage the funding that they get and to, in a smart way, work together to make the most of the money that are allocated. And so a lot of the funding mechanisms already required those who provide services for homeless individuals to work collaboratively. So we figured this would be a good way to reinforce that pattern of behavior and type of interaction. A large number of stakeholders were engaged in providing services to homeless people in Utah. And a lot of stakeholders were quite engaged and felt very strongly about what should be done. So we knew we'd have to talk to and bring together a really large number of stakeholders and try to help them develop a vision of where Utah should be going and how their specific work was going to fit into this. Salt Lake is one of the continuum of care units that Jesus talked about. And they had actually, right as we were beginning this work, moved from being a network of service providers concerned with homelessness to an alliance to end homelessness. So they had found a collaborative approach and a collaborative format that was specific to Salt Lake that they felt comfortable with and wanted to push forward. And just that unit had a tremendous amount of organizations represented, and Michelle Flynn and Sean McMillan can talk more about that specific alliance. But we knew a lot of stakeholders would need to be involved, and so collaborating would be necessary. Another aspect is that Jesus and I are educators, and as educators, we're always looking to create teaching and learning moments, whether we're in a faculty meeting, whether we're talking to community service providers, or if we are planning for our students. We're always looking to see what opportunities there are to practice the kinds of behaviors, processes, and dialogue that we want to see. So we thought that if we're going to do this, try and help these communities develop a strategic plan, we should do that in a way that actually models and gives these communities a chance to practice the collaboration we're hoping to see, right? And so we asked them in these focus groups to do a lot of difficult things. We asked them to come together to form an understanding of each other's priorities and perspectives, to do a joint inventory of their resources and their needs that they had locally, and to define what the top priorities for their local community in terms of homelessness were. And this is not easy work, but it is exactly the kind of work that needs a collaborative approach. And so how we set up the focus groups and ran those was specifically to help model and give opportunities to practice the collaboration that homeless service provision requires to be successful and effective. So having talked a little bit about learning while doing, that's sort of the, creating opportunities to practice collaboration while we're doing it. I'm going to mention a couple of things that work into the next slide, which is about developing trust. Okay, hold on just a second, Jesus. One of the things to remember is that as a stakeholder, where you stand on an issue often depends on where you sit. So your organization's role in the system, or its function, or in your specific job kind of shapes your perspective on the issue and your interests involved. And sometimes that perspective can be pretty narrow, pretty myopic. And it can be hard to take in the big picture of what's happening in a whole state, what's happening within a whole service provision system, and to understand how the system operates and what each organization contributes to that whole. And so it's easy to lose track of sort of the bigger picture and get sucked into the more minute details of what's happening every day, and sort of the crisis du jour, the crisis of the day that is right in front of you and that's pulling at your resources and your attention. So part of what we were doing in this collaborative approach was to make sure that we helped communities remember and keep track of the long-term developments and long-term goals. So kind of help them be the guide and support them in thinking long-term and developing a strategic perspective on the issues and the solutions to those issues for their community. But in order to become a trusted leader for these communities, we needed to do a couple of different things. And first, I'm going to show you a slide of who are these communities and stakeholders that we're talking about. This is a very rough drawing of the clusters of stakeholders that were involved in this process. On the left, you see examples of the types of stakeholders that were involved at the local level. And the next level up, the continuum of care, Mountain Land, Salt Lake City, Balance of States, were the three sort of coordinating bodies that coordinated local homeless coordinating bodies. So we had that, we had our research team, we had our community partner, which was Department of Workforce Services. We also had a lot of federal actors, and we had experts in other states in the area of homeless services, et cetera. And then we had a state homeless coordinating committee. So kind of the parties on the left side were the ones that we were out talking to, and that we needed to develop a lot of trust with. So moving on to the next slide. In order to get collaboration, let me start over. In order to even address complex social situations and needs, you need partnerships and teams. In order to have successful partnerships and teams, you need trust. And I think there are a lot of social workers listening to this conversation, and I think that you will find as you're working in the field that most of the important work is done in teams. And whether that's an alliance between you and the client, or if you are working with the people that have the expertise and access to resources that you need in order to help and support your client, you will be teaming up with them. And so we knew that trust was important for this collaborative relationship and this partnership. So we used roughly a 10-step model on how to do a strategic planning process that is based on consent, and where sort of how you were going to run the process, how you were going to develop a plan, was a point of negotiated agreement from the beginning. So some of the things that we knew were important to develop trust were face-to-face interactions, a clear process for managing the conversation, so ground rules for exchanging ideas and values, accountability, holding participants accountable to the rules, but also clearly following the rules ourselves. And finally, transparency. If people don't have to worry that their information is going to be turned against them, or that the people running the process have ulterior motives or will try to manipulate the outcomes, if they are transparent in what they're doing, then the participants can focus on just participating and authentically engaging in creative thinking and true dialogue, which is really what we were hoping to do to help the state develop a good strategic plan. A couple of the things that we had to do, Jesus and I and the students who were helping us with this research and the focus groups, was we had to show that the process we were suggesting could actually work. We had to build some trust with our community partner and the leaders of these three continuum of care coordinating bodies, because if they didn't trust that our process was going to be effective and lead to useful information, they were not going to open the doors that we needed open for us in order to do this work. And it was important for us that they could see and experience themselves that the focus group process and the kinds of questions we were asking and how we would run those focus groups would actually facilitate an authentic dialogue and help people get to the heart of the issues. So one of the first things we had to do was actually do this process with those key leaders. And once they saw that it actually did work and it was effective, it was very easy for us to ask for their help and support in getting local community members and stakeholders together to do these focus groups. Another way that we tried to develop trust was to be willing to step out of our comfort zone and kind of be the first ones to step up to the plate and be willing to do what is difficult. So Jesus was referring to this traveling that we were doing. We set up the focus group process so that we went to every single local coordinating committee meeting that we could in the short amount of time we had available. So we toured all of Utah in cars to meet them where they were at and to see their local conditions and to make it easy for them, as easy as possible, to participate so we could get as diverse a set of participants as possible, but also to show them that we are not sitting here in our ivory tower, analyzing this from afar. We are not sitting just in Salt Lake and care only about what's happening immediately around the Capitol, but we are really interested in hearing and seeing what the conditions are like in all of Utah. That led some interesting logistics, but also a wonderful way of seeing our state. The final point here, transparency, accountability, and incorporating feedback. We did a number of things in this process that I think are important. We drafted the full suggested strategic plan, and then our community partner, the Department of Workforce Services, went through page by page in a in-person, face-to-face meeting, every single thing we had jotted down, and gave us feedback and suggested changes, not just on the ideas, but how they were being expressed in terms of the intent and the tone and the message that was given back to the communities. And we had a long dialogue about this, and we got to go back to our own offices and discuss amongst ourselves, Jesus and I, what we were going to do with that feedback, and how far we were willing to compromise to get a product that everybody could buy into. So we did this a number of times, and the community partner invited experts that they wanted to weigh in on how the plan was coming together. We did this a number of times back and forth, and it was very much a transparent and intense process that we don't usually do in research otherwise. I'm going to transition now to the next part, which is really about finding solutions to homelessness in Utah. After doing this enormous work of talking to experts, reading everything we could about homelessness and data collection, and doing these focus groups, we found a number of things. We focused on community needs and service gaps, ways to improve coordination within Utah and different localities and different stakeholders, trying to find benchmarks or how to think about benchmarking so that you can assess performance and see whether or not we're getting better at doing this or worse, if what we're trying is improving the situation or actually not helping at all. And then coming up with concrete recommendations of what should be done, not just what could be done, but what should be done. So we spent a lot of time poring over the data that we had and identifying strategic issues. And this is basically a thematic analysis of what are people saying? What are common themes? And there were a number of common themes that we uncovered that kind of went for all of Utah. But as we will see in the next slide, not quite yet, but there are also things about Utah that make homelessness different in many different parts of the state. So we read through all of the national plans, the federal plans, we looked at best practices, and we really tried to focus on action steps, right? Not just theoretically what helps, but what changes can we make that will actually make an impact? What will move the needle? And to carefully craft and articulate a plan of implementation, because it's the mother of all problems. You can have great ideas, but if you don't have a solid plan for implementation and specifying who's going to do what, it is likely to stall in the competition with other priorities. So we went ahead and put the, I don't know what number it was, but the full draft of the plan out for public comment. And we got public comments from quite important community leaders and stakeholders. Then we took that feedback and got the charge to implement as much of the feedback and suggestions as we possibly could. And I think for trust building and accountability, it was important that these stakeholders that had taken time to read our draft plan and give us suggestions to make it better could see that their comments actually made it into the final draft. So I worked very hard on trying to implement all of the changes that had been suggested that would improve the plan. And we finally were asked two things by our community by our community partner. One was to show how Utah's plan, with all the local priorities and measures suggested, would map onto the federal plan. That is, how far off was Utah from the federal plan, and to what extent did it address the things that the federal plan suggested would be a good idea. So that was part of a Herculean effort that is in the appendix to the actual plan. I sent a link through the comment section to the actual plan, and that mapping to the federal plan and match is available there in the appendix. Now, let me talk a little bit about the specific issues in Utah that came out of this work. And so some of the things that we came up with and that we kind of saw across the state was the need to prioritize and to develop some way of benchmarking where we are now so that we know whether or not we're getting better. And there was a strong desire to link funding to the priorities that local communities had agreed on, right? So empowering local communities and local leadership to solve local issues. Even though homelessness is a statewide issue, the specific conditions and the specific needs and available resources are, to a large extent, the knowledge of local people. So we were doing that. We were asked to come up with a benchmark, and as researchers, we were really hesitant because nationally, no plan had really specified exactly how many, what's progress, right? How many fewer people on the streets makes progress, right? How much shorter should a stay in an emergency shelter be to be considered progress, right? So we had to think about really hard about what is useful and what is functional, right? So we ended up incorporating a measure that would allow local communities, based on their own priorities, if they got them funded, to reduce that priority by 10% or increase it by 10%, depending on which way they were hoping that the numbers would go in order to make progress. We also saw a great need to share expertise. So we suggested continuing the work that Department of Workforce Services had already started, which is sharing best practices and knowledge among homeless service providers in Utah. So now there's an annual conference and some other resources to help pool expertise across Utah while still prioritizing and strengthening local control of what's actually done locally. There are a number of other statewide issues that I think kind of summarizes statewide strategic concerns for Utah. One is affordable housing. I don't know if you've noticed, but housing prices are even crazier this year than they were last year. This is an ongoing and massive challenge for the state of Utah to have available affordable housing to people in the lower fourth of the economic income bracket. Permanent supportive housing and emergency beds are also high priorities. We need more of both of those things. Mental health services and substance use disorder treatment is in shortage and something that we need more of across the state, as our stakeholders identified. Case management, and this is particularly important for social work, there is a great need for case management when it comes to homeless populations because they have such complex problem pictures and healthcare needs. And so case management is key to successful transitions, and we need more of that. Prevention, diversion, and outreach services to make sure that fewer people get into a situation where they are actually acutely homeless is something that we need to prioritize. Better data on what's actually going on in Utah and give the full story would be key to seeing improvement. And then available transportation for homeless people who are being sheltered and or put in rapid rehousing programs in order to allow them to get access to services and to be able to gain and keep employment. Now, I thought I'd set the link up in the chat. I will cut and paste it again, but I'm going to stop here and let Sean take over in terms of our discussion of our experiences. Thanks.
All right, thank you, Dr. Jesus and Dr. Jesus, Dr. Valero, I'm sorry, and Dr. Svedin. We're pleased to welcome our panelists now to the discussion. They will introduce themselves and share some thoughts from their own work with those experiencing homelessness. Dr. Sarah Canham, University of Utah, we'll begin with you. Then I'd like to hear from Michelle Flynn and then Miles Southworth.
Thank you, Sean. And yeah, thank you, Lina and Jesus. That you guys have done an amazing job with getting such rich information in such short period of time. For those who don't know me, I'm an associate professor in the colleges of social work and architecture and planning at the University of Utah. And my own research looks at issues of homelessness recently in Salt Lake, but previously in other areas. So some of the work that as you're speaking, there's so much parallels. So when I first moved to Utah and I came across the report, I was really excited to read what was going on in Utah last year. And so one of my students a BSW student and an MSW student took on a research project of her own to go out and do interviews with persons with lived experience of homelessness only in the Salt Lake County area. So I know you did the whole statewide travel bit, but we confined ourselves to the Salt Lake area. And I was just taking some notes about even talking about how you went about getting the information is really interesting. So needing to build trust in order to get the information is an interesting parallel. So in our work, in our interviews that we did, we heard from people experiencing homelessness about their need to feel trusting relationships in order to engage in receiving services from service providers. And so it's interesting, they expressed a lot of hopelessness and shame around their experiences of homelessness. And when they interact with the service sector and the service system, that need to feel that they are in a trusting relationship with their providers in order to access that care. So I think that's a really interesting parallel. And the other one that really struck out is how you essentially went to meet people where they are in order to access the data from the service providers. And so the parallel there for our research was that, in order for outreach workers to interface with people experiencing homelessness and to engage them in receiving services, essentially they are meeting people where they're at and figuring out what their individual goals are as well. So it's a really interesting parallel between providing service and then also accessing the information that we need from people. So I'll stop there, but I'm just thrilled to be part of this panel and look forward to our discussion.
Good afternoon, everyone. Again, Michelle Flynn with The Road Home. I'm honored to be part of this panel with some of my former professors and colleagues, talking about kind of this bigger picture of how we can really make significant changes in homelessness and reduce homelessness in our community. I think a couple of thoughts I have, and then I'm eager to get into the dialogue. One is that for those of us who do this work on a daily basis, we're working, as was mentioned before, with different individuals and different families who have different kinds of needs, different reasons that led to their experience of homelessness. And we're faced with working with people in crisis every single day. Our incredible team members at The Road Home dig in and get to know all the resources in the community. Where's different kinds of help available? How do we develop relationships? That work is happening all day, every day, on a very, very individual basis. And at the same time, we as an agency are very committed to the overall picture of reducing homelessness in Salt Lake County and in the state of Utah and across our nation. And how do we create the space and time for that? And I think about what Dr. Svedin and Dr. Valero talked about regarding this really important need for collaboration and cross-sector collaboration. So a lot of the time in our world, we talk about how do we help people who are experiencing homelessness right now. We see people who are living out on the streets. We're working with people who are staying in homeless shelters. We're looking at the needs that are happening there. But we also know that in order to really make that significant change, we have to look at the structures in our community that led to homelessness in the first place. And what is our seat at the table to have those conversations about poverty and about affordable housing and the lack of affordable housing and how we got here. The issues of structural racism, the issues of income inequality and wages, that and lack of connection with behavioral health services that could have kept people housed in the first place. And sometimes it's hard to get to that work. And so we're thrilled to have our University of Utah partners help us with the state plan. As Dr. Svedin mentioned, or Dr. Valero, one of them, we created the Salt Lake Valley Coalition to End Homelessness almost about a year and a half ago, Sean, something like that, maybe in our second year. And this was very deliberate process where we looked at all the groups that had been meeting and talking about the issue of homelessness and the stakeholders that needed to be involved to create solutions. And we structured a group, and I'll put the link up on the chat, that really looked at all the different sectors and factors. And we created 8 subgroups that had specific focuses and many task force that are connected with those subgroups that led up to a steering committee. And that steering committee now is essentially our Salt Lake County Continuum of Care and feeds up into the state and the State Homeless Coordinating Committee. And so, some of the challenges that we face is just a lack of investment or understanding for the need for investment over the years for the homeless sector to have a real capacity to look at data, to collect data, to analyze data, to use data to see what was working and not working. We're a sector that started very grassroots with people just wanting to help those who are vulnerable in our community. And it grew out of churches and really frontline kinds of work. And now we are much more sophisticated group of individuals who really do look and want to analyze. But how do we do that? How do we move past that crisis that we're facing every day and really create the space to collect the data and look at this kind of analysis and then take it to, as Lina said, this implementation phase. Take all these plans that we put together and actually implement them. And so that's really where the important work is being done, and where it's so important to have all the stakeholders together with the same goal, looking at the benchmarks, looking at how we're moving towards those benchmarks, and the importance of, for example, our elected officials who sometimes don't have as long a view span on homelessness as us, but they're so important and such important partners. How do we move past just addressing the issues of people sleeping outside on the streets today to the point where we can create the kind of systems and housing with support to avoid having this number of people living on the streets to begin with? So I will leave it at that. Thank you.
Miles, please.
All right, thank you guys for having me. I'm a police officer with the Salt Lake City Police Department, and I first got involved with the homelessness issue in Salt Lake in that role. I was assigned to the downtown bike squad working in the Rio Grande area and working closely with a lot of these community partners. And man, it's one of those issues I went into bright-eyed and bushy-tailed, really feeling optimistic about making a big difference and helping people out in this community. And as a police officer, your role is really limited and the tools you have are really limited. And that's when I discovered how much we rely on all these different organizations, like First Step and the Road Home and all these church groups and all these different community partners that are playing different roles in trying to address this incredibly complicated issue. It's something I've become really passionate about and really wanted to get involved in. And so it was really, really an honor and a privilege when Dr. Valero and Dr. Svedin provided students with an opportunity to get involved in this strategic plan. And it was really eye-opening going around to these different communities. I looked at it through this narrow lens of law enforcement and this narrow lens of homelessness in Salt Lake. And as we go to these rural communities and go into these different parts of the state, they're all experiencing this issue in a unique capacity. And they're all trying to find solutions for it in their own role. And so it was really, it's cool. I'm inspired by the work that Dr. Svedin and Dr. Valero have done to kind of kick off connecting all these groups, connecting all these stakeholders, getting so many people involved to tackle this incredibly complex problem.
Well, thank you, everyone. A question that comes to mind, well, no, I want to get to one of the participant questions. The question was, you may go over this later, but as a student of the University of Utah, how can I get involved with this work? Go.
You can answer that too, Sean.
I know.
We love to work with the students from all places, but most of our organizations have internships. We would love for you to come and start doing internships or start even by volunteering. Some of our volunteering is limited currently due to COVID-19 restrictions, but we still do have opportunities. And then we're happy to, I'm always happy to come and speak to classes about the work that we do, or have some of our social workers come and share. There is such a variety of kind of work that you can do in the case management and social work field, whether it's working for a housing authority or a shelter provider or behavioral health provider. There's many, many, many opportunities. And so, yeah, any way that we can help.
I would echo what Michelle said. I would add that I actually welcome letters of inquiry. So you're a student and you know that you're going to have to find an internship opportunity. If you have a particular interest, I like it when I get a letter from a student who says, I want to do this kind of work. If you have an internship opportunity, please consider me. It just demonstrates passion. It demonstrates commitment to the work that we're all doing. Dr. Canham, you as faculty might want to speak to this question.
Yeah, it's funny how everybody brings their own frame of reference to it, right? I was like, oh, I did, yes, I was thinking research. Yes, we have great research opportunities for you. And I'm sure, the other faculty on the call may be thinking very similar things. But yes, if you're ever interested in doing research with faculty in this area, I would say the same exact thing that Sean said. Send them a letter of inquiry saying that you're passionate about this work. I would say that I get students introducing themselves to me that way quite often. So I would encourage that. And I imagine that the other faculty in this call would feel similarly to that. So yes.
And if I can do a quick plug-in also, if you're interested in the management, leadership of public nonprofit organizations, consider a degree in a program of public affairs, like a Master of Public Administration or Master of Public Policy. We have some alums here in this call, so we'd love to have you. So feel free to reach out to myself or Dr. Svedin, and we'd like to connect you to our programs as well.
And there's also, I believe, a joint, a joint between the PA program and the social work program. There's a certificate in social justice leadership. So that's, I teach one of the courses for that certificate. So there's an opportunity there too to sort of bridge the fields of social work and program administration.
There's even a joint Masters of Social Work and Masters of Public Administration dual degree. But I would also say, in terms of research, just email the professors either on this panel. It might be a good place to start. We love getting interest from students, and sometimes we have projects that are going on. Sometimes we're just thinking about something that we don't have manpower enough to do yet. And so getting emails from students is a good way to get digging on a topic. And if I'm busy and don't have enough bandwidth to do it, I will kick you over to Dr. Valero or Dr. Kenham or one of our community practitioners that we know would love a hand or are interested in mentoring students. So just get in touch with one of us and we will find a way to help you get engaged.
Lisa Homonis asks an important question, and I know that in my field, that's something that I struggle with because I see its impact. I see how people hold themselves back or limit their options because of stigma that is present for the person themselves. They feel shame, but also those biases that we as systems and how our systems may have created barriers for individuals who have experienced homelessness. Can we talk about that for just a second, and where you see that and what you think we can do to address it?
I think stigma is a really significant part of dealing with things like homelessness, mental illness, substance abuse, a lot of the trauma that underlie a lot of symptomatic behaviors. So people that have behavioral problems are often people who've experienced great trauma. And unless we understand where people are coming from and a little bit about what they've been through, we're going to continue to judge them on the surface level, right? On how they express themselves or the behavior that we think we're seeing, right? So for me, engaging in this kind of research, having dialogue with people who are in this service community, and to talk to people who are experiencing how we're treating them through policy and in our interactions, is super important to break down this barrier between us and them, right? Thinking that this is something that happens to other people that have some sort of deficit. No, homelessness is something that happens and can happen to all of us. Most people are only 1 or 2 paychecks away from not being able to pay their rent or their mortgage. And a hospital bill, an accident, losing a job in this market, it's easy to lose a job. That might be what causes you to become homeless, but then that generates a number of other problems. Or you never had access to healthcare that you needed and you become ill. And I just think that education is really important to reduce the amount of stigma. Stigma has never helped anybody. And so if we want to get at the issue, if we want to reduce the problem, we need to look at why we think these people are different from us, right? And to see that stigma is just fear, right? It's a way to try to keep the problem away from us because we don't know it and we don't understand it.
And I just wanted to talk about trauma-informed care a little bit more specifically. We really jumped into this about 3 years ago and implemented a comprehensive training program across our entire agency, really with a focus on having every single one of our staff, from the accounting department to the people that are at the front lines, really understand where the people were coming from, and so that we could do everything we could to help them feel more welcome. Our goal is to have every interaction with somebody in one of our programs, have them walk away from that feeling more safe and more empowered after that conversation. And it's so important. There's a lot of effort in many organizations to move to that trauma-informed service model. And I think our next step really is to have that be across the community with all organizations. And then on the other side, working with people out in the community who come to the table with these misconceptions. I do firmly believe that, in one-on-one conversations, and it's part of our duty to help educate and inform really why people become homeless and what we see on a day-to-day basis. And most people are thoughtful and will open up their mind and just really haven't thought it through. Most people start from a place of thinking about their own experiences in life and then find it challenging perhaps to translate that to someone who's experiencing homelessness who may have had a very different experience in their life. And so I think that's also a really important role for the Road Home and other agencies, is to help inform and educate the community as a whole and stakeholders as a whole. And I will say my first acquaintance with Dr. Svedin was her volunteering behind the front desk at our women's shelter. And so she has a long history of wanting to engage with people on the front lines. Thank you.
Officer Southworth, I'd love to hear your perspective on this.
Yeah, this is something that is very, very relevant in law enforcement in a lot of different ways right now. But with the homeless population, one of the things that's particularly challenging is you go and you experience so many things. I remember when I first got down there, it was overdose after overdose after overdose, and stabbings and shootings, and so much violence and drug dealing like crazy. And it just seems so overwhelming. And it's easy to start to dehumanize people and start to label them and try to, like, oh, these people, they're all transients. They're all dopers, tweakers. Like, there's a million different biases that start to reveal themselves as you do this work. And I think the most important thing for addressing it is keeping track of people's humanity and humanizing every individual that you're dealing with, and being aware of, we label people in these ways, and we do it maybe as a shortcut or for whatever reason. But I do think the key is humanizing every individual and looking at them as an individual that is experiencing life in their own unique way, and trying to understand what their needs are, what their motivations are, and how you can help people in these situations. And that's going to be a challenge for law enforcement in every category that we deal with.
If I could just add one short thing real quick, I just building off what other people are saying, and I think we also sort of talking what Dr. Svedin and Michelle were saying is, we very quickly categorize people into us and them or other, but people themselves who have experiences of homelessness and housing insecurity self-stigmatize themselves. And that leads to sort of this disempowerment that Michelle is speaking to, and our need really to sort of recognize and appreciate the experiences that people, or the expectations that people are putting on themselves and what they're going through as well. And so I've thought a lot about this stigma piece. And what's really interesting is to me, sort of, this academic approach to it, is we have words for racism and sexism, for ageism, which is what I primarily study, aging. But we actually don't have a word for the stigmatization towards people based on their lack of housing. And so I've been using this word homism just because, as a first step, like, if we can name it and we recognize it as something that's unique and different, then perhaps we can start engaging in these conversations about, building off what Miles is talking about. We lump people into drug users or people who have severe mental illness in these different names and categories, but we haven't really given a name to people, that we're completely stigmatizing based on their lack of housing. So I think that that's a important move for our society to go towards. But again, I'm just an academic, so I don't,
Just an academic. I wanted to get to some things that I saw as sort of a theme or featured prominently in the research that Dr. Svedin and Valero did, and has to do with negotiating the tension that exists within the homeless services world. And what I mean by that is that Salt Lake County, as well as the state of Utah, but particularly Salt Lake County, has a very robust community provider network, a network of nonprofit organizations that are passionate about their mission. And I would suggest that when those folks are not at the table and able to be part of the solution, they will venture off into their own direction to address the problem in the way that they think is appropriate. But there has been a lot of collaboration, and this study, this research demonstrated that. Salt Lake Valley Coalition to End Homelessness, which has north of 50 organizations, I would suspect, part of it, and more than 200 members of the coalition. Very robust stuff going on, but I know that there's interesting stuff interesting programs, interesting collaborations going on within the Salt Lake County, within Salt Lake City PD. Michelle, you're aware of other programs, collaborations where, an organization is good at one thing and they know they're good at one thing, but they also recognize that the people that they serve have a set of needs that go beyond the area that your particular organization focuses on. Can you talk about those collaborations, or the other panelists? Can you talk about innovative or collaborations that you've seen in the community since you've been here? Please.
Sure, I'll start. There's so many, and I think that, as we know, one of the important roles of nonprofits in society is to have that sort of flexibility and bring innovation to the table and be able to move quickly based on what we're seeing on a daily basis. And it's important and very different than government's role. I think I have many things that come to mind. I'll speak to the collaboration around helping people who have been living in and out of shelters for many years, individuals that have experienced chronic homelessness and often co-occurring disorders. For quite some time, when we were providing shelter down in the Rio Grande neighborhood, we worked closely with the police department and the fire department and others, and they would come and say, well, how come Miss Sue is still out here? We all know that she's got serious mental health issues and she's coming in and out. We're getting calls to come and address whatever's happening with her on a regular basis. And we would say, well, we're coming from this perspective of a shelter and trying to work with behavioral health partners who structurally aren't funded to be able to come down here and sit in the lobby of the shelter and wait until Miss Sue was ready to engage with them. It just functionally, bureaucratically wasn't possible for the type of funding that supported those services. So we worked on that issue and continue to work on that issue for many years. But one of the innovative projects we developed was a partnership with Salt Lake City. And it was very focused and funded through some private sources, and Salt Lake City funding continues to be supported by Salt Lake City. And we call it House 20. And it's this collaboration with a small group that includes Volunteers of America, who does outreach services, the Road Home and 4th Street Clinic, who provides health services, as well as the Salt Lake City Police and Fire Department. And they get together on a regular basis and bring to the table those individuals who are high on the radar screen of those particular organizations, the Salt Lake City departments. And we're able to focus and track and figure out what's happening in the Road Home through this program. Has 2 staff that literally only have a caseload of 10 each, which is practically unheard of, but gives them the time and the ability to continue to work and track down Miss Sue wherever she is. The 4th Street Clinic will call if she shows up there. The police will let us know if she's hanging out in Liberty Park or something like that. And we're able to really address those folks who are just always at the top of the radar screen for Salt Lake City. And they just felt like, as Miles was saying, how do we help? How do we get this person connected with all those resources? And that was very responsive to something that we were seeing at the time, and creative and innovative and very, very, very collaborative. And I think, I could speak a lot about the collaborations with law enforcement, which have evolved tremendously over the last number of years, and really evolved. And I'm thinking of this trusting relationship and how important that is, not only with the people we're serving, but with each other, and building trust between a homeless service provider organization and law enforcement agency. It can be challenging, and it takes a lot of hard work and face-to-face meetings, to the point where, down on Rio Grande Street, we had multiple meetings a week, and a meeting every week where leadership was there, leadership of the Road Home and law enforcement, along with the frontline staff, for a year long, until we could get to that place, and really truly develop some incredible trust with our law enforcement partners, that we trusted them to listen and see us and value our input. And then the the same way in reverse. We got to the point where we really trusted and wanted the input of law enforcement. If they were saying, you know, this person is really a predator, I know you're trying to work with them, but this is someone who is causing so many problems, we have to address it in a law enforcement manner, that we trusted their input and they trusted ours if we were, you know, saying something different. So it takes a lot of time and dedication. And I think not only from that frontline staff who do such amazing work at this every day, but it takes the leadership of the organizations to be there and to send that message that this is important.
Yeah, you mind if I add on to that? Yeah, and Michelle, you hit it right on the head. I think that relationship of trust, I mean, law enforcement, whether we like it or not, is called to respond to issues of homelessness nonstop. And whether it's somebody that's camping out on the street or using drugs in a business bathroom or whatever it is, there's so many different issues where we get called, we get involved, and I mean, oftentimes law enforcement involvement exacerbates the problems, and the police, we're realizing that we are not the best tool to address a lot of these issues. And some of the innovative things that we've done, and also circling back to opportunities that somebody asked about, the Salt Lake City Police Department hires social workers, full-time social workers, and they go out and respond to a lot of these cases, and they help to coordinate resources and try and get people in touch with what resources are available to them, and it provides us as law enforcement a different tool. And I honestly think more and more our futures are bound together as social workers and law enforcement, because so many of these issues overlap. And I just, one of the testaments to this model that Michelle described, there was an individual who I dealt with for years, and severe mental health issues, a really, really nice guy, but you have a conversation with him and he's telling you that he's Bob Marley and goes off on this tangent that like you can't understand or have like a really meaningful dialogue with this individual. And we'd constantly get called because he doesn't have his pants on, and we'd give him a belt or we'd tie a rope around his pants trying to keep him up. And 5 minutes later, we're getting another call that his pants are off and he's in the middle of downtown. We're getting call after call. And I remember banging my head against the wall and trying to tell everybody I could possibly tell about this issue. And it just went in circles. And I was really inspired to hear that just recently, this individual, he's got housing and he's getting long-term mental health treatment. And it's something I thought would never happen. And so it is a testament that these innovative approaches are working and they're making a difference slowly but surely. And I think we're continuing to learn the better ways to address issues, and we're continuing to evolve in what our roles are and how to implement our roles in the most appropriate situations.
If I can weigh in a little bit and tie the two questions together about stigma and about innovative approaches, one of the things I think is really critical to reducing stigma is familiarity, right? So you have to have a personal connection to somebody who's experienced a problem that you're currently stigmatizing in order to make it possible in some ways to shift your perspective, right? If you're not getting educated or informed by somebody else, you know, when you know somebody who is experiencing the problem that is heavily stigmatized, you can no longer be as drastic in your judgment as you would have been had you known nobody that had that life experience. So what I want to say with this is what we can do in Utah, in Salt Lake, in the Valley, is to continue to promote, push, require developers to continue to integrate affordable housing in districts where other people have a higher affluence level, right? We have to continue to have mixed neighborhoods. We have to continue to integrate affordable housing units and permanent supportive housing in regular neighborhoods where people who are facing fewer problems and less trauma live. That way we all get to know somebody in our neighborhood who's experiencing these problems. We can reduce stigma. We can provide an environment that is different from, for instance, the Rio Grande neighborhood, where there was so much violence and so many problems in just, the congregation in that community. We can continue to house people, permanent supportive housing and affordable housing, rapid rehousing, in neighborhoods that are less violent, that are less traumatic, right? So we give both sides of the communities, both those who are high needs and those who actually have a lot and can provide a lot, right? If we integrate those, we will reduce stigma, we will see more integration, and we will have a different environment for those people to get better, right?
So I wanted to chime in on this point because it's so important, and also presents an opportunity for collaboration. So First Step House has recently within the last 3-4 years, moved into the housing development space. So we have started to develop affordable housing, specifically deeply affordable housing, specifically permanent supportive housing. And we were asked to do that by one of our community stakeholders. They knew we had land and they knew that we wanted to develop affordable housing, but we did not have the organizational capacity. Well, as soon as we said yes, then trustworthy people stepped forward and said, I'd like to introduce you to these folks over here. They know a lot about this. And they are also particularly interested or have some experience developing deeply affordable housing where services are integrated. Well, what has ended up happening, because we're a behavioral health services provider, we're not a housing provider, is that they oriented us to a world, they oriented us to a process that is very exciting to us. The other thing that happened is that we as a behavioral health services provider came to learn that we had infrastructure because we have all of that capacity to bill for behavioral health services built into what we do. And it meshed really quite nicely with what we need to be able to do as a community to deliver behavioral health services to individuals with complex needs in the community. And so I want to say that there to this audience, that there are lots of different ways to collaborate, and there are talents, assets that you in your capacity, your organization may have that you didn't know are assets to someone else. And if you got a dream, speak up about it. That's what I would say. All right, it is, I show 1:23, and we have to wrap up by 1:30. How about closing comments from folks?
I'll be happy to start. I'm really glad we had the opportunity to have this conversation. As I've mentioned before, having conversations is one of the foundations for building collaboration and building trust and building understanding, right? So I'm really grateful for that. And I want to say that Utah should be optimistic. I think there are many things that we've seen in our research that Utah does well, right? We have a greater amount of collaborative experience than many other states. We have some really excellent service providers. We have a huge nonprofit sector and people who are really committed to providing social services in our state. So we have a lot of things going for us. We also have some tremendous challenges that we are well equipped to take on if we choose to direct our actions, right? Affordable housing, permanent supportive housing, changing stigma and understanding of homeless populations in our wider community, and continuing to fund through public funds the services that our community members need. But I think there's every reason in the world to be optimistic as a Utahn that we can actually move the needle on this and make a difference because of some of the inherent qualities that our communities have in the work that we're doing.
I'm happy to go next as well. So again, an incredible opportunity to be here today. Thank you to Sean for moderating and for the College of Social Work for hosting this. And just a quick thought of, yes, I echo everything Lina has just shared, that, we learned a great deal through our work with developing the strategic plan. And building these incredible community relationships. And I'm also very optimistic about the future of Utah, and specifically of our ability to really tackle this issue moving forward. I also want to note that the pandemic has certainly placed some strains on the homeless service sector and system in Utah. I had the pleasure of working on a report with the Utah Foundation and did a survey of service providers. And some of the challenges that providers are reporting are things like the health safety of their staff, a reduction of loss of financial resources and increased demand for services, and maintaining morale and motivation among staff. And the least of the challenges reported was a lack of collaboration. So that was a really great thing to see, that collaboration is happening, and that the pandemic is not challenging the ability of service providers to come together, to talk, to engage in dialogue, and identify possible solutions and strategies for dealing with this problem. And it was not then surprising to see that some of the mitigation strategies that organizations are adopting are very collaborative in nature. So all of this gives me a ton of hope, and again, grateful for this opportunity, and look forward to engaging and continuing dialogue over this important topic and issue facing our community in the state of Utah.
We're all waiting for who's going to go next. I'll just say I agree. There's a lot of positive. There's so many good things that are happening. So many good things that are happening, and we don't do a good enough job getting the word out about all the good things that are happening. And for people that are just reading in the newspapers, you mostly just hear about the challenges. I will say I'll just say one of the amazing things that has happened is we have seen a significant decrease in homelessness from veterans in our community. And that is due to definitely an investment from the federal government in ending homelessness for veterans. And I'll just give kudos to our incredible veteran housing team we have at the Road Home, and all the partners that have targeted this, where we are identifying anytime someone who enters the homelessness system anywhere says that they're a veteran, we're immediately there and assessing how we can help, and connecting people with the VA campus for all the benefits that they can offer. And we will have hopefully some more exciting news around ending veteran homelessness this year. That will be really important and is a good model for us to follow in other areas. So good stuff.
Miles,
All right,
please
Miles.
go. Oh, no, go ahead, Sarah, please.
Okay, I was like, I'll go. Miles can end it for us. So yeah, I just want to reiterate what everybody has said. I think sort of wrapping back to one of the first things that we talked about was the multidimensional nature of homelessness, and I think that really speaks to what we're kind of wrapping up here with, which is the need for people of all different sectors, students, social workers, people in PA, people in law enforcement, people working at the Road Home, all to sort of come together. So there's lots of different roles we can all take in working towards finding people safe, affordable places where they can live. And so even being part of the Salt Lake Valley Coalition to End Homelessness is something that people can join and be part of that coalition to see what different efforts are happening, whether it's in the transportation realm, whether it's the health realm, the housing realm. So there's lots of different avenues that you can bring towards these efforts. And I would just encourage, anybody, students or otherwise, to really just sort of reach out and see where you can, make your mark and contribute to the effort. So thank you for the opportunity and for having me here with such esteemed folks. So that's it for me.
Yeah, thank you all so much. It really is an honor to be in the company that we have here. These are some of the great minds and the local leaders that I've really looked up to in the community, and Dr. Valero and Dr. Svedin being the tip of the sword for helping the state move forward in developing a strategy for such a complex issue. And just want to end on the note to invite everybody to try and be a part of the solution to these problems. It's one thing to be upset about issues or raise awareness about an issue, but the next step is now to try and find meaningful solutions. And so I think I want to invite us all to continue going forward and finding those meaningful solutions in the community. Thank you.
All right, thank you so much. With that, my closing statement. Thank you, Dean Teasley and the College of Social Work for your focus on the grand challenges and support of this and future grand challenge events. Thank you to our presenters and panelists for your time here today and for your research and service on this critical issue. Thanks to all of you for joining us today. We hope to see you at the next Grand Challenge event on October 14th, a conversation on smart decarceration with Fordham University Law Professor John Pfaff, a national expert on the topic. Please visit the college's event page for information on this and other events. With that, again, thank you all so much. Appreciate your time. And to our attendees, thank you so much for making your time, making yourself available to sit in on this with us. I hope it was worth your time. Thank you.